Look, thank you for having me. I'm really honored to be here to speak with you all and to Northwell for putting this all together, Michael and the whole team. I am an investor. I apologize for that, but that is what I do for a living. I was in medicine, and I think, as Michael said, we're all focused on healthcare. We're all focused on how can we make the lives of people better, and some people say longer, but clearly better. How can people live a better life? And it reminds me of a question, so I want to ask you all a question, and I can't really see out into the audience because there's blaring lights, but I want to start and take a little poll, which is a question that someone asked me. They said, well, you're an investor in healthcare, an investor in having people live longer, better. So the question is, are there more people alive today, about 7 to 7.5 billion, that have ever lived on the earth prior to the people living today? So who thinks there are more people alive today than have ever lived before? And I see some hands up. Come on. I mean, you're going to have to vote one way or the other. So I'm looking, and I see about 30, 40%. Who thinks there have been more people alive than prior to living today? Okay, a lot of people didn't vote. But I'm going to tell you that the majority have said that there are more people alive today than have ever lived before. So I'll come back to that, see if it's relevant. So I'm an investor. What I do for a living is I talk to people and I try to identify good innovation that should be funded in the healthcare sector and specifically life sciences. And a lot of people ask me, how do I do this? What is the process for identifying investments that we should be funding? So I'm going to talk a little bit about that. The first slide here, and I have about 7 slides if you bear with me. The first slide here shows what the value chain is that we look at for innovation in life sciences, and it starts with basic science. It moves through clinical investigation, regulatory approval, and a commercial launch. And we always ask the question, if there is a company that we're looking at or an idea, where are they along that value creation curve, and where do we think the markets will reward them for moving across that value creation curve? For some companies, it's very early with a single patient of data, and for other companies, it takes commercial execution. So it's our job to figure out where that is. And in any idea or company you're looking at, that will be a different value creation curve. But that's a very academic statement because really these value creation curves are not smooth S-curves that you would learn at Wharton or HBS. They're actually a large number of discontinuous step functions. And what you ought to be looking at is, what step function are you investing in? So if you're the manager, if you're the entrepreneur, what step function are you presenting to the investor? And that step function is the value creation function. And we ask 3 questions. First question we ask is, do you as the manager, the entrepreneur, know how much capital, time, and what is the de-risking event you are going to do to get to the next value creation point? Because if I'm going to give you capital and you don't achieve that, you're going to come back to the markets for more capital and you haven't created any value. Right? So it's really critically important to know what the length is of that horizontal line. It's then really important to know, can you skew, can you de-risk the upside downside of being right? A lot of people say these are binary risks. I prefer to call them bimodal risk, where the bimodality is skewed 75 to 80% towards being right versus being wrong. And finally, will you get rewarded for putting capital at risk? That's the third question. A lot of people also ask today about where are the markets today. I will be one that would say, I don't want to be quoted on any device here, I'll be one to say the markets are full right now. Certainly full in the life sciences milieu, and probably broader in healthcare. But we don't invest in markets, neither should any of you invest in markets. And the new ideas that you are bringing to the market is not the entire market, it's a specific idea. So you should understand what is froth when you see froth. We define froth as the moment in which perceived value or market value exceeds fundamental value. We prefer to look for ideas where fundamental value is ahead of perceived value. And that then goes back to that step function. So then what do? We want to dissect that step function, and I mentioned 3 different elements, right? What is the horizontal? What happens at the split? And how high can the upside be if you are correct on the split? This is the ideology of good investing. And so we always ask the first question, any meeting I'm in and I'm talking to somebody is, it's a piece of arithmetic I do with the CEO or CFO, which is, what does your balance sheet look like? What will your balance sheet be after you do the proposed financing? And is that balance sheet sufficient to achieve the value that you've told me that you want to achieve? The simplest meetings I'll ever have is if that balance sheet is not sufficient, because then you just smile ask a couple of easy questions, but there's no way you're investing, right? Because you will be diluted later, and diluted without having any value creation. Second question is it going to work, right? So that's the real diligence. That's when you get in deep, you talk to experts, and you figure out, is the idea sound, and is the idea skewed, that bimodality, towards working? And then finally you say, what's the upside? If you're going to put risk capital to work, is the upside worth putting that risk capital in? And that's when you talk to the management, what's your vision? How are you executing? What's your strategy? Do you need to partner? Do you need to keep it all internally? So it's those questions that tell you what's the true upside. So then we talk about putting it all together, and you say, okay, I've met with a company and they seem great. They've got a great management team, they've got a great idea, they've got a great plan to execute on that idea, and they have a balance sheet to enable them to execute on that idea. But a lot of times I'll meet with great companies, but it doesn't mean it's a great investment. I mean, people have already mentioned Apple. Apple's clearly a great company, but is Apple always a great investment? J&J is clearly a great company. It's the finest company in healthcare, some would argue. I would say it is. But is it always a great investment to invest in J&J? No, it's not always a great investment. And what is the difference between a great company or a great idea and a great investment opportunity? That is valuation. So we do spend a lot of time talking about valuation. So I want to make another comment, because some of you in the audience may be managers, entrepreneurs, and some of you may be investors. And I'd say the job of the manager is to optimize or maximize free cash flow, future free cash flow. Every day you get up, how am I going to run more efficiently? How am I going to get new good ideas? How am I going to create more value? Maximize future free cash flow. It is the job of the investor to decide what they're willing to pay for that perceived future free cash flow. And the two should not cross. It is not healthy for a manager to be obsessed about what their multiple should be. They should just figure out a way to optimize free cash flow. It is not the job of the investor to try to get involved in the management's day-to-day activities to maximize that free cash flow. But I will say what a manager should do is be aware of what drives an investor to think about a multiple, and that multiple is the relative valuation, what they're willing to pay for perceived future free cash flow. So my team and I came up with these ilities. So this is, yes, it's true. So I'm going to ask us all to, in unison, like sometimes we do in church or synagogue or whatever, I want to ask us all to state these 6 words that I have on this page, because I spent a lot of time thinking about these 6 words to have them rhyme. Okay, ready? So let's go. 1, 2, 3. Scalability, visibility, sustainability, profitability, credibility, and reasonability. Now, if I had more time, I would take you through each word and what we are looking for when we are speaking to managers and a new idea. But it's these words, and they're somewhat amorphous, that drive what is the relative reason why you will pay one price for one company and a different price for a different company that does basically the same thing. The one word, though, that I will harp on here is credibility. Management teams should be honest, truthful, and realistic when they speak to managers. All right, 2 slides left, and I say I have 2 minutes, so I'm going to go a little bit quickly, but I want to make a couple more points. From the perspective of the company, why do companies need to reinvent themselves? Why do they need to look for new innovation and continue to strive for greatness? Well, in the industry that I spend the most time in, the biopharmaceutical industry, they are faced with a conundrum because they do have pricing power due to artificial monopolies, due to intellectual property. They also know that they're going to lose that artificial monopoly because things are going to go off patent. So it's like buying a new car, you drive it off the lot, it's immediately devalued by 30%. This happens with drugs and medical devices once they're launched, because as soon as they're launched, the market's going to look and say, oh, okay, well, you have this great thing, but you have 8 years left, so what are you going to do after that? So the value of the asset is in decline from the very moment that you get it to market. Those are the circles, right? At the same time, you're building a balance sheet because you've created value with these assets, you've received cash, and you put that in the bank. The problem is the market's willing to pay you 10 to 20x for the perceived future free cash flow that the asset will give you, but the market is going to give you probably 1x, if not under 1x, the value for the cash that you're holding in the bank. So what do you need to do? You need to reinvest that capital back into creating new assets. And some companies are afraid to do this, and this is my last slide, and this is why. there is a fear psychology to investing, and this could be by investors or by companies looking to reinvest capital into their own ideas. And I'm not going to have time to list these 4 things, but this is a psychology problem. And the one that I want to focus on is just the third one, which cites that people think that if they don't make a decision to invest, they're safe. And because if they do make a decision to invest or move into a new area, they can only be wrong and they can be outed for being wrong. And I think this is a big mistake. I think companies need to realize that the price of not doing something is as risky as the price of doing things. So I will thank you there. So I was a little rushed. I do want to stick to my time, but I will thank you. And I will answer the question that there have been 14 times as many people that have lived on the earth and have since passed than there are currently living on the earth. I got that wrong as well. So the answer is there's 14 times more people that have died already. So we have a big job to do. Thank you for your time.